Hello, my name is Rohit Mehta. I'm a cardiac electrophysiologist here at Sanger Heart and Vascular Institute as part of Atrium Health.
And my name is Sejra Patella, and I'm one of the nurse practitioners at Sanger Heart and Vascular. And we're here to talk to you about atrial fibrillation and how diet and exercise affect AFib. So we get asked a lot about diet and exercise in our clinic. And so we're here today to talk about food choices and how we can make diet simpler for patients when it comes to treating AFib. So Ro, you get asked this question a lot. How does diet affect atrial fibrillation?
So diet affects atrial fibrillation quite a bit. I would argue that diet actually is the main predictor of atrial fibrillation and risk. So when we think about cardiovascular disease, and atrial fibrillation is a marker of cardiovascular disease, diet affects it heavily. So what are the things that are kind of the misnomers? So the idea that low-fat diets help with cardiovascular disease is actually a bit of a myth and has actually been really changing in a lot of the science that is put forth. So today we really look a lot at sugars and glycemic index of our foods, and AFib is no different. So whether it be the risk that alcohol gives to increasing AFib burden, a large driver of that is actually the glycemic index that's associated with alcohol. So we have a few foods here on the table for us. And so when we look at things, we should always really look at the label. So this is a sparkling soda, and it seems like it should be healthy because it's nice and orange. But when I look at the label, that has a total of 26 grams of sugar. So when we look at that, that's about 10% of the total sugar you should get in the course of a day. Now imagine if you drink 10 of these, you've now exceeded your total sugar requirement for the day. Now, for instance, we look at a superfood like sweet potatoes. Sweet potatoes actually have high carbohydrates, but overall a low glycemic index, meaning that they're fairly good sugars and a lower amount of sugars in general. So as a general rule, what we would suggest are things that come out of the ground. So think green leafy vegetables, avocados, sweet potatoes, apples, anything that have their own skin and their own packaging. If it comes in more artificial packaging, so think about things like granulated sugar, flour, the notorious candy that we always snack on in the middle of the day, even something as ubiquitous as rice. So white rice has a tremendous sugar content, our breads. So we should look at other grains like quinoa and brown rice and oats as things that we can substitute for the things that have higher sugars like the white breads and the white rices.
So if I was going to pick a sugar, if we're going to cook with sugar, what would you suggest would be a good choice?
Well, in general, again, things found in nature. So natural sugars, so like agave syrups, maple syrup, which is one of my favorites, honey. Those are all things that tend to have still sugar content, but they're more natural sugars. And so a lot of the phytonutrients that are contained within will help manage the effects that the sugar has on our disease, and specifically atrial fibrillation.
So I get asked this all the time in clinic. Are there any specific diets that are better for atrial fibrillation and that we should be telling patients what to eat?
No, great point and great question, Sejra. So, a big part of it is I like to deal with general guidelines, because I think if we give patients rules to follow versus specific diets to follow, I think it helps. So in general, we would recommend foods that have a low glycemic index. There's actually data from a group in Australia that actually looks at this specifically, and upwards of a 90% drop in atrial fibrillation risk. And what this means is that you can literally go online and look up a glycemic index. And if the number is below 55, that would be a low glycemic index food. So for instance, granulated sugar would be very high on the glycemic index, but when you look at something like agave sugars, it would be very low on the glycemic index. So two things that are probably equally sweet that have vast differences in glycemic index. So low glycemic index diets, and specifically the things that I tend to favor, are things like plant-based diets, pescatarian diets. When we start looking at some of the fad diets, and specifically there are several where we have to be very careful because they can promote cardiovascular disease and promote atrial fibrillation. And the thing that comes to mind most frequently is actually the ketogenic diet. So I strongly discourage patients from actually using the ketogenic diet, even though it helps people lose weight. that weight comes at a cost, which is really cardiovascular disease and atrial fibrillation.
So when it comes to caffeine, this is another question I get asked all the time. Does caffeine affect AFib?
Great question. You know, for decades and decades and decades, we had given the advice that caffeine can materially affect your atrial fibrillation. And really over the past 3 to 4 years, there have been 2 definitive studies that have answered this. Number one, when you look at coffee drinkers, the first study really showed that there was no deleterious effect. So patients that drank coffee were at no higher risk of atrial fibrillation than others. The other thing that was kind of interesting is the following year, a study came out actually looking at the incidence of atrial fibrillation in coffee drinkers. And specifically, they actually ended up having a lower risk of atrial fibrillation in general. So while I wouldn't suggest going off on a coffee binge to prevent your atrial fib, what I can say is that if you're like me and you really need that cup of joe in the morning, it's absolutely fine to have. Again, be mindful of what you put in the cup of coffee. So when you load it up with granulated sugars versus things like honey, agave syrups, or maple syrup, which is my favorite, then it's absolutely fine to have.
So what are some other things in regards to diet and health and well-being that affect atrial fibrillation?
Yeah, great question. So, you know, the things that we always point to are things like that are in front of us, right? Food. But, you know, weight, and specifically not so much weight, but fitness becomes important. And, you know, Sadra, I know you're going to show us a lot about this in just a second, but really kind of controlling weight through the active choice of good foods. The other thing is, you know, it's summertime. A lot of people like to go out, maybe have a beer or a glass of wine. Alcohol is another thing that you have to have under control when you think about atrial fibrillation. So moderate to large amounts of alcohol, and that could mean something as simple as 2 glasses of wine a night, can considerably increase your risk of atrial fibrillation. So that's something that we always ask our patients to back off on, and specifically look at, again, low glycemic index alcohols as well. If you are going to have a drink, make sure that the sugar content of that drink is controlled. The other thing is sleep, and this is the one thing that I think has been under-recognized. When we look at patients that have atrial fibrillation, a large majority of patients have coexisting sleep apnea. So if your spouse or partner tells you, hey, you're snoring a lot at night, or if they've kind of been kicked out of the bedroom because you're snoring so much, it's probably worth seeing a sleep specialist, because these are things that can contribute meaningfully to atrial fibrillation risk. So it appears that, you know, diet plays a beneficial role when we use the right things when it comes to our atrial fibrillation. But, you know, exercise tends to get a little confusing. So Sadra, help me understand, is exercise helpful? Is it hurtful? Like, what's the verdict on this?
Yes. So exercise is helpful in the treatment of atrial fibrillation. And multiple studies have actually shown it can reduce the number of days patients are in AFib. So we highly encourage exercise once diagnosed with AFib.
So if a patient asks, they go in and out of atrial fibrillation, you know, when they exercise, wouldn't they potentially promote their AFib at that time? Wouldn't that cause them to go into AFib?
No, not necessarily. So the rule of thumb for patients is think about what your heart rate is at rest. And if it goes up to, it should actually elevate when you exercise, right? That's a normal response to exercise. The question is if you're fast at rest, over 110 beats a minute while sitting, you might actually be in AFib. And so therefore, if you don't feel well, you would stop. But to exercise in AFib is safe as well. It just really depends on your baseline resting heart rate.
So Sadra, you know, you've told us that exercise helps when it comes to atrial fibrillation, right. but I'm confused. I don't exercise regularly, so how do I get started? What are the types of exercises that I need to be doing?
Sure, that's a great question. So just like AFib, it's highly individualized. So you have to tailor the exercise program based on that patient's specific needs and ability, right? But the American College of Cardiology recommends about 150 minutes a week of moderate exercise. These types of exercises are brisk walking, climbing stairs, taking hikes, doubles tennis, And even pushing your lawnmower can be considered moderate exercise. But I will say, it doesn't have to be intense to be considered effective. And that's the take home when it comes to exercise.
So Sandra, that was helpful in terms of helping me get started on an exercise program. But look, I get home late, right? And at work, how do I find time at work? How do I find time after work? What are the tools you can help me with in terms of implementing this?
Right, that's important. So we just spoke about how atrial fibrillation is influenced by exercise, and it can actually reduce the number of episodes of AFib. So when patients find value in that, and that they know they're going to have less AFib days, that can motivate them to want to exercise. So I recommend patients start small, set weekly goals, even daily goals. Today I'm going to go for a bike ride. Tomorrow I'm going to go for a hike, and commit to that. It takes 90 days to make a habit. And so if you can incorporate, start small, and then work yourself bigger.
So Sandra, we spend a lot of time in atrial fibrillation thinking about heart rate.
Right.
So what's a good heart rate?
So that's also very individualized based on your own resting heart rate. But with exercise, we expect your heart rate to go up. That's a normal response. And as you exercise and condition yourself, that will get easier and the sensation will get better.
So even if I'm in atrial fibrillation all the time, I expect my heart rate to go up during exercise?
Absolutely. So yes, we can expect your heart rate to get elevated. Now, obviously, if you're short of breath or having some limitations, you should stop. So we all can do a little bit better when it comes to diet and exercise. I think that we can all agree upon that. And I know after talking to you about some of my choices with sugar, I'm going to probably lay off the candy a little bit more. And you're going to do some more sit-ups?
Of course, absolutely. So, I think a big part of what we've all learned today is that, food is medicine and exercise is medicine. So I really think we need to commit to those things, even as small doses. Every little bit helps. And Sandra, thanks for helping us understand that.
Yes, let's make it fun for our patients.
Absolutely.